My name is Dr. Jylana Sheats. I'm associate professor at Tulane University School of Public Health and Tropical Medicine, and the associate director of the Science and Society program at the Aspen Institute. Before I introduce our esteemed panelists, I do want to take a moment to frame our conversation. Public health storytelling isn't just about sharing information. It shapes how people perceive challenges, how they make decisions, and how they take action. Whether it's through film, social media, podcast, journalism, or even advocacy, the way that we tell stories has the power to influence understanding and drive real change. However, as we all know, and what's been communicated today, is that not all messages resonate as intended. And so I want you to take a second to even think about a public health message that truly changed how you thought or acted, but at the same time, consider one that missed the mark, one that felt out of touch or even alienating. And I think that over the course of the morning and early afternoon, we've had some clear examples of those types of messages. And so while some narratives build trust and inspire transformation, others create confusion or may reinforce inequities. And so at a time when trust in public health is both fragile and essential, storytelling can bridge a complex health issue and even lived experiences, making public health more relevant, accessible, and actionable. And so today I'm co-moderating with Dr. Amml Hussein, and through our esteemed panelists, we'll explore how public health storytelling can be a catalyst for trust, equity, and lasting societal transformation. And so I'm honored to introduce Melissa Fleming, the Undersecretary General for Global Communications at the United Nations Department of Global Communications, Erica Rosenthal, the Director of Research at USC's Annenberg Norman Lear Center, Laura Hughes, the Principal and Founder of Gusto Partners and was previously at PolicyLink, and Lori Rose Benson, the former CEO of Hip Hop Public Health and Principal at Sanus Advisors. And now you'll hear from my colleague, Amml.
Thank you, Jylana, for introducing and framing today's discussion. My name is Dr. Amml Hussein. I am a Civic Science Fellow at Boston University at the College of Communication, and I'm also the president of the National Association of Social Workers in the New Jersey chapter. So I want to thank you all for joining us today for the discussion. Over the next 60 minutes, we'll hear from an incredible lineup of experts, panelists who bring expertise in global communications, media impact research, community-based storytelling, and innovative public health messaging. To keep our discussion focused and engaged, we're going to start with some structured questions, and during the last few minutes, we'll also open it up for the floor for questions. So let's begin with brief introductions. Can each of you please briefly introduce yourself and share an example of a story or a narrative from your work that has impacted you or your organization? In 1 minute.
In 1 minute. Thank you, Amml, and it's great to be here. Nice to meet you all. Good to see familiar faces, and also I had the pleasure of getting my master's degree from Boston University College of Communication, and it's great to see the dean here, and that education taught me a lot, but never prepared me for the communications environment that we are living in now. In fact, I thought I had seen it all in the course of my career in terms of active disinformation campaigns against the work that we were trying to do. For example, at the International Atomic Energy Agency, where I was the spokesperson, I had the pleasure of going on TV and saying that we are not seeing anywhere a revival of Iraq's nuclear weapons program. We got a lot of pushback, and you know the end of that story. But the explosion of disinformation as a weaponized tool to manipulate people, to disarm, to attack, and to seize power, and also to make profit, is now the landscape in which we operate. And it's an enormous challenge no matter what we're trying to communicate about, and whether it is, I think in the end what we all want is to have the same basis of facts that everyone can believe, and that's something that we have to all join forces to reach, and it's really inspiring to listen to you and to come together, because just finally we're about to issue a UN first ever risks report. It should be out in the next few weeks, where we surveyed our entire country operations in 193 countries, including also other stakeholders. And the top risk that emerged was mis and disinformation. And it was the risk that emerged as the one that people were most concerned about, because it was polarizing our society and making the world a better place, very difficult. But also it was the risk that was considered to be that we are the least prepared to address. And this is all over the world. So we have a lot to talk about today, and thank you very much.
Hi, everyone. I'm so delighted to be here. Thank you to Aspen and MIT. Laura Hughes. I'm a narrative strategist, which means I help to tell the stories that evoke the core emotions and tie into deep mental models to move progressive causes. I work primarily around housing justice, democracy, birth equity, LGBTQ rights. And I think the most powerful, like, chef's kiss story I heard came from the St. Paul Keep St. Paul home. It's housing bill that happened, and part of their story was ultimately they wanted folks to look outside their door and see their neighbors and not wonder if they were renters or homeowners. Simplistic, profound, and resulted in the passing of numerous rent control bills.
Hi, everyone. Lori Rose Benson. When I think about the career that I've had, my 30-year cadence and rhythm in public health and public education, it's really all been about music and about movement. The through line of moving, whether I started out as a New York City public school teacher in East New York, Brooklyn, teaching music, art, and physical education, to leading the first ever Office of School Wellness Programs under the Bloomberg administration for the New York City Department of Education, to most recently the inaugural executive director of Hip Hop Public Health, which is a nonprofit that uses music and art and culture to teach health literacy and lift up young people, particularly in communities that are underserved. I want to focus on not necessarily a story, but I want to talk a little bit about music. We heard a little bit about film, a little bit about comedy. Think about the music in your life. Can you think back to a time where there's a song that when you hear that song, it evokes a certain memory, a certain feeling that lifts you up, that calms you down? You know, music is one of the most untapped resources that can augment learning, that can cement memories, that can even build circuitry in our brain. I'm not the neuroscientist in the family. I know we have you out here, but working with the founder of Hip Hop Public Health, Dr. Olajide Williams, I've learned that there's more real estate in our brains for music, more neural real estate for music than language itself. So what I want to kind of bring to the forefront today is thinking about how through different modalities, through multisensory modalities like music and movement and dance, things that can connect so deeply to emotions and cultures, you know, why do we not think about that more for public health communication, for public health education, the way advertisers and marketers do so well to maybe get us to buy what we don't need to buy or do what we don't need to do? Why don't we use it in a way that we know can help lift up communities in a really culturally relevant, connected way? Thrilled to be here with all of you.
Hi, everyone. My name's Erica Rosenthal. I'm the Director of Research at the Norman Lear Center, which is a research center based at USC. And we study the power of media narratives in entertainment, in journalism, documentary film, social media, on a really wide range of topics. So we look at what are the stories that are being told through media? Who are the audiences that are consuming these stories? And what is the impact of these stories on audiences, knowledge, attitudes, and behavior, and the science behind this impact? What psychological mechanisms are responsible for the power of media narratives? So in addition to our research side, which I lead, we also have a program called Hollywood Health and Society, which conducts outreach to the entertainment industry on health topics, climate change, criminal justice, national security issues. So I'll share an anecdote from that side that really demonstrates the power and the vast reach of entertainment narratives. Who here watched How to Get Away with Murder when it was on? Just show of hands. Anybody? A few. So we worked with How to Get Away with Murder on many different topics, but one of those topics was an HIV testing storyline involving one of the key couples in the show, Connor and Oliver. So they go to get tested together, and spoiler, one of them is positive, not the one you would expect. But we heard from a health educator in New York who heard from a nurse at a clinic, just one clinic in New York, that people were coming in and mentioning that they were getting tested because of this show. They just saw an overwhelming influx of patients, and the nurse asked, what motivated you to come in? And like 5 patients in an hour said, oh, I saw the storyline on How to Get Away with Murder. So that was just one clinic in 1 hour the day after the storyline aired. So it really can reach mass audiences even in this day of audience fragmentation.
Yeah. Thank you so much for that. As you all see, our panelists today will provide a diversity of perspectives. This next question is going to be for Lori Rose and Melissa. Public health storytelling can be a powerful tool, but as I mentioned earlier, not all stories land as intended. So what are some key challenges in crafting stories that lead to real change?
Do you want to start?
Sure. No, I think one of the biggest challenges is not just crafting the story. The bigger challenge is how to get it to reach the people who need to hear it. So especially in this age where most people are getting information on digital channels, and so what we've really learned, no matter if we're communicating on COVID-19 or now on climate change and climate solutions, is broadcasting from headquarters of the UN in New York doesn't really work. To a certain extent, we have millions of followers on our social media channels, but particularly in areas where people are becoming increasingly skeptical. We heard so much good evidence this morning about the use of trusted messengers, and we have developed a methodology that is based on trusted messengers. And I'd like to say the disinformation actors of this world use trusted messengers. They are trusted messengers. They don't have to tell stories and deliver messages based on facts. That's one of our challenges. So number one, our challenge is that we have to communicate facts. And facts are sometimes boring, nuanced. As we heard this morning also, it's science that's changing that maybe it might require you to take measures that you don't like. So I think that we just need to understand that, and I completely agree with the advice that we also heard this morning, that we need to explain why it is that way up front. But we have a communication strategy at the UN that's based on 3 W's, and I know there's some journalists in the room, you learned the 5 W's of journalism. Our 3 W's are what, why care, and what now. So the what is the part that we've all traditionally, at institutions, in academia, we do really well. We communicate the facts. But the why care part is the big challenge, because that requires you, first of all, to do the kind of storytelling that is going to get people to care, but also to figure out how you're going to reach them in the languages that they speak, and on the platforms where they are, to be in those spaces where mis and disinformation are traveling and provide an alternative. And then the third W is what now? So, we also need to understand that people are feeling very overwhelmed. There's a lot of, just the volume of information. WHO during COVID-19 called what we were experiencing an infodemic. And it wasn't just that there was a lot of bad information that was leading people astray, but there was too much. People couldn't figure it out. So what now? Giving people things to do. And then I think we were able to talk about our methodology, our campaign that's called Verified, that we rolled out and tested during COVID-19. We trained doctors and scientists because polls said that doctors and scientists in a pandemic are still the most trusted people in communities. We worked with them in communities and countries, trained them on TikTok, and got TikTok to verify them. And in every single case in every country, they became a big TikTok star. They became the go-to people on the national television. And the UN was nowhere to be seen. We said, look, we're just going to give you the facts. We're going to deliver on a daily basis. This is the information that we have today. Just go and create. Just go and speak to your communities. And that worked. And now we're doing a similar model for climate, but this time with lifestyle influencers.
Okay, so we did not talk about this beforehand. We did not plan this.
Okay.
Jylana. So you have your 3 W's. I like to talk about 4 M's. So, and you all talked about this earlier today about the trusted messenger. For us at Hip Hop Public Health, and I'll keep saying us, I've transitioned on from the organization, but I'm still lovingly on the advisory board, so we'll continue to lift it up and speak that way. The trusted messenger can be the musician, the artist, those that people really connect to. But for us, it's also the young person in someone's life. We work really deeply in the K through 12 space. And much of where Hip Hop Public Health started was sort of the absence of quality health education. And so using an evidence-based model, the model that Dr. Williams created is called the multisensory, multi-level health education model, with young people at its core. And so if young people can learn and develop health literacy through music, through movement, through areas that grab their attention, when attention is one of the biggest commodities these days, right? It's so valuable. But then not only improve their knowledge, maybe take steps down pathways towards health behavior change, but also impart that knowledge to their families in an intergenerational way. So that's more of a child-mediated health communication model. That's like the most jargon I'm going to say today. And that being said, thinking about those messengers and trusting the young people, but then when the young people would come home and they would talk about and do these exercises with their parents. And we started working with the guardians of hip hop. And I can tell this is like a very hip hop adjacent audience right away. I feel it. I feel the vibe, right? And so like Dougie Fresh. How many people know Dougie Fresh? Just say, yeah. I know you all do. And if you don't know, you do know. Because he, the Dougie, Michelle Obama, when she was doing the Dougie on stage anyway. Dougie was one of the guardians of hip-hop who created beatboxing, which is how you make sounds with your mouth. And at any rate, young people would come home and start talking about resources. And the kids didn't necessarily know who Dougie Fresh was, or DMC, or Chuck D from Public Enemy, or Ashanti, but they knew, they loved the music, and they would talk about it with their families. They were like, wait a second, what do you know about Dougie Fresh? Right? And so it was a way to connect families and capture attention and soften messages about health areas that maybe families didn't want to talk about. But then I'll just quickly say the other 3 M's. So you have the messenger, but it's also the message itself, right? And understanding what it is we want people to know and be able to do as a result of this information. It's the medium where you're finding folks. So maybe the medium is through music, maybe it's through a social media platform. Maybe it's through the faith-based community, but understanding that. And then the last is really about the moment. You know, we heard earlier about talking about, oh, maybe a faux pas, doing something on Christmas Eve, right? But thinking about how those all interact in a really, really specific way, I think is one way to really think about that culturally tailored approach to communication and health education.
All right, thank you. Such great reflections, especially just with thinking about the what, the why care, and the now, as well as the messenger and the moment and the other M's. So, thank you for that. Laura, this question is for you. Could you talk a little bit about how you identify and understand your audience when crafting public health messages? And are there any key questions or tools that you use to ensure relevance and connection?
Yeah, absolutely. So just let me kick off by saying I'm a narrative strategist. So I want to give you a quick definition. Narrative, you look up at the stars. Each star is a story. A narrative is a constellation. So I spend time building scaffolding around the constellation, the deep mental models that underlie how we tell stories, right? So I just want to level set. That's how I look at it. So I got good and bad news for you. So if you tell me that your audience is everyone, that means to me you're talking to no one, right? So, you know, hopefully not everybody loves that and feels ruffled. That means I did my job, right? But generally, overall, that's the first thing I always tell folks. If you had to pick one audience, who are you talking to? And I really, really push you on it. I would also say earlier today, just anecdotally, I was on a call around democratic research and design folks, and they were saying, you know, one of the things Republicans are really good at is they pick an audience and message directly to that audience. Progressives pick an issue and try to message to everybody. Interesting reflection. So I always hold audience segmentation. So who I do storytelling to progressive audiences, and I was a director of narrative strategy at PolicyLink, and we had an audience segmentation about how people felt about race and racism, and that's my audience segmentation I used. So we specifically talked to the 10% of people that were part of the anti-racist and advocate base, and I talked to the 67% of people who were persuadables. That's who I talk to. I didn't spend any time on anyone who made the hair on the back of your neck stand up. Not my people. Don't worry about it. You don't need them for this, right? So I always encourage folks to be really clear about the messages you're holding in that segmentation. Also within that, I would tell and remind folks constantly, you know what we're really good at? Talking to that same 10 to 15% of people who agree with exactly what I say. I make eye contact with you. You're like, we people, we're going to talk after this. That's the base. What I don't do so great about is the people, when I look at them, I'm like, yes, yes, and then they say something. I'm like, what happened? We were doing so well. Then they had to say something crazy, right? That's your persuadable base, right? That's how you identify folks. Also within audience segmentation tools that are readily available to you, people give you, you know, they are X, Y, and Z democratic. They believe X, Y, and Z. And so I would say for tools, I always encourage folks, if you're formally looking at research, there's audience segmentations that are available like PolicyLink, like the Pew Charitable Trust, like Harmony Labs. These other narrative organizations very easily give you a way to look at Americans that you're talking to. I think the other thing that I'll highlight about who you talk to is that nuanced stories are needed for the complexity we are facing. So it no longer works, right, if it ever has worked, to just tell stories broadly and think that someone's going to pick them up, right? I think the second part of this quickly is just around trends I pay attention to as I think about the work I hold. So I look broadly at different trends, right? So the New York Times had trends to expect in 2025. One of those was that wrinkles are going to be embraced. Now you may say to yourself, what the heck am I going to do with that? But if I also told you that the luxury index projected that health and wellness was going to be the #1 spend of luxury things over the next X number of years. I would also tell you I took a look at Reframe's trends, and they had some beautiful announcements about how Beyonce was going to carry the culture. Now, see, all of these roll up, right? So if you're thinking about how you tell stories around HPV vaccines, you might automatically be like, well, I don't know, I'm going to tie that to a wellness trend. But this is telling you the landscape that's around you. It helps you to nuance the stories to fit with the complexity of the environment. And those are really, really critical things. I think the last thing I'll share that I really love about audience segmentation, and this might just be like tips and tactics, like Laura steered you the right direction. If you look at the landscape of Marvel Comics and Black Panther and Wakanda, for example, so Batman always had Robin. Shuri always had T'Challa. right? Everyone was part of a movement. And now the stories that are being told across this culture are about leaderful moments, right? So if you tell a story about one individual who did something really great, people are not attracted to that nor moved by that. They are interested in stories that represent a full movement, connect to other pieces. And so I always advise folks, particularly if you're thinking about health and science storytelling, there are so many people who are movement adjacent who are not part of your population. Folks who just worked on housing advocacy are ripe to be your next people. Find out who they are and talk to them. Know your audience.
All right. Thank you. In addition to knowing your audience, you have to know about metrics as well. So I'm going to ask Erica a question, and then we're going to switch up the format a little bit and take some questions from the audience or online. So write your question down. And remember, a question ends with a question mark. But Erica, what metrics or indicators do you use to evaluate the impact of public health stories on behavior change and community transformation? And could you provide an example of how you've used these metrics to refine your approach?
Yeah, absolutely. So we use a variety of different metrics. We do content analysis research to understand what messages are currently being conveyed, to establish a baseline, and then to track progress against that baseline over time. We do audience segmentation research, like Laura mentioned. A lot of our research is audience impact measurement to understand how these stories conveyed through different media are moving audiences. So are there shifts in knowledge? Are there attitude changes, intentions to act? Measuring actual behavior can be very difficult. We typically do this through survey research and conducting longitudinal surveys to be able to measure behavior change long after the fact is extremely challenging and expensive to be able to follow up with people months, years, potentially down the line. So a lot of what we measure in the behavior space is kind of precursors to behavior. So things like self-efficacy, feeling like you have the confidence to take this particular action, behavioral intentions, and self-reported behaviors. And often it's not, massive behavior change around the health issue that we're talking about, not necessarily going and getting an HIV test or a vaccination, but talking with your friends or family about this topic, or about a story that you saw on TV about this topic, engaging in information seeking, posting on social media. These are the types of actions that people can very easily take. Often when our outreach team works on a TV storyline, they'll do a PSA with the stars of the show in conjunction with that storyline, and it'll provide a link to an organization that works on this issue, and we'll partner with that organization to track traffic to their website. And very frequently we see near doubling in traffic in the immediate day or two after a particular storyline airs, compared to the typical traffic that they see. We also do social media research to understand, what audiences are talking about, how they're talking about a particular issue, and whether they're making the connections between the entertainment or other media narrative that they just saw to that issue. What was the second part of the question?
It was, could you provide an example of how you've used the metrics?
Absolutely. So we often do impact research on the stories that our Hollywood Health and Society team has consulted on, as well as other organizations who work in the sort of narrative change space. So organizations like Define American, who work on immigration research, or Illuminative, who works on Native American representation. So this happens frequently with our content analysis research. We'll identify gaps and opportunities in representations of different populations or different topics, and that feeds back into the outreach that these organizations take to the entertainment industry, not so much to tell them what to write. Like, we come from the perspective that the entertainment industry folks are the master storytellers, so we're not trying to tell them how to tell their stories. But here are some things that you might want to be aware of, just in terms of how your stories have the potential to affect audiences and what's missing.
As a behavioral scientist, I heard hints of the theory of planned behavior in your work, so that was exciting to me. So we'll take a couple of questions, and then for the panelists, if you all could give like 30-second responses if you feel like the question resonates with you. All right, so do we have any questions? All right, we have one in the back.
Hi there, I'm Nicole Mlinarik. I work on the communications team at a biology research institute in San Diego, and I know there's a lot of institutional communicators here. Today, there's been some discussion about how as our science journalism industry is sort of weakened, there is potentially a growing role for institutional science communicators to be communicating more directly to the public. And I certainly am in science communications because I care about social transformation, but we work on teams and have leadership that institutional comms also has limited resources, and so we get a lot of directives to focus on media that's going to support our visibility, our reputation, and our funding, private and public. So for in contexts where our bosses and leaders aren't necessarily prioritizing social transformation, I guess I'm curious what you see the role of institutional science communicators being in this whole movement, and what message we can take back to our institutes to help convince our leadership, our faculty, of the importance of using social transformation, of working towards that goal in our work and prioritizing that as much as our more acute institutional goals.
I can start. I mean, I think I would start with the first point that you made, which is that we're seeing a decline of science journalism. And in fact, there's an assault on journalism. It's both financial but also journalists are under attack, as you know, not just in this country, but in many countries around the world. And so we're not going to be able to rely on, we need to support journalists and give them the tools, the information that they need, and advocate for them. But we also need to take their place where there are those gaps. And at the UN, we have UN News and we try to separate in a way the kind of more straight communications from the advocacy communications, because our UN News is actually like a news wire that is so credible because we have former journalists working there, and we do not put, we make sure that it could be used, just reprinted for free. It's a free service, and it is, and it's multimedia as well. So I think that's extremely important. We have to continue to help journalists, and even more so than ever before, do their jobs. But where they are no longer able to function, and where we have news deserts and gaps in journalism, I think we need to step in.
Okay, and there's a question online, I believe.
Yeah, so there's a question online. Thanks. I'm going to reframe it a little because it was actually a question that was asked of an earlier panel, but I think it's especially relevant to this question of public health. And so the asker, anonymous, made the distinction between sort of conversations about what is true versus conversations about what is right. Okay, so we've got like what is moral or good over here, what is true or what is factual over here. Mm-hmm. They're distinct things that might have some crossover. Both of them, I think, are relevant for a public health conversation. And then taking it a little bit further, how do we foster the type of trust that's required of a public who's making public health decisions that can potentially feel scary or that are potentially worrisome based on historical wrongs?
I'll talk about an example of a program that I created that was somewhat in that vein to address those areas. So shifting from COVID, talking a little bit more about youth mental health and the mental health crisis. And that's been heavily stigmatized for a really long time. And so instead of going out there and just saying, like, these are the resources that we have, and this is what we should do, and this is what... We created a program called Moving the Needle. Music, moving the... Now, for those of you that don't know, there were these things called records. Put the needle on the record when the drum beat... Okay. These records, and then put the needle on the record, but also moving the needle one conversation at a time around health and healing. And so when we started to have these conversations around mental health, we brought in folks that were, the medical experts or the education experts, but we also brought in an artist, and we also brought in a community member or a youth member. And we hosted these in particular communities where this was something that was bubbling up and there wasn't a lot of conversation. So we hosted live events, but then we captured that content, we shared that out widely, and then we also asked those artists that had a really wide web of influence to share that out as well. So I think, in a way it could soften. It's not necessarily a matter of like what is right and what is moral, but bringing a lot of community stakeholders to the table with varying levels of influence was just one way that we tried to address the topic that no one really wanted to talk about very much in the communities that we were working deeply with.
Thank you.
Can I get on?
Briefly.
So, real quick. So, as soon as you start to fall into the truth versus right, I feel like we've already lost, right? And then if you accidentally repeat what you're trying to debunk, that you really lost, right? You just What I tell folks, and this is from a narrative perspective, I'm asking you to go 400 feet, which means we should have done this 5 years ago, but to offer an aspirational future. What does health equity look like? What does it feel like? What does it sound like? Right? So it wasn't until a year later after working with folks, I realized that safe and equitable housing for all people to me smelled like tomato vines. With my mom growing up, I would pick tomatoes, the smell lingers on your fingers. To folks in New Orleans I work with, they said, you know what safe housing feels like? Kids laughing and gumbo that you can smell. Now, if I asked you, what does health equity do in any of those spaces? I think I might get some radio silence. And you might be able to tell me everything you're up against, right? And that's easy, especially in this moment that's really hard. But people are looking for an aspirational future. Take them on the journey with you, right? That's what I really believe.
Thank you. That was really powerful. Thank you. So the next question is for Erica and Laura. How do you ensure that public health stories reflect the lived experiences of diverse communities? And can you share examples or strategies or creative approaches that have worked well for you?
Do you want to go first?
You please.
So we don't craft our own stories at my organization. We partner with the entertainment industry in recognition that they're really the master storytellers. And I think in terms of appealing to diverse communities, we connect them with experts who are not just scientific experts, but experts who bring their own lived experience to these issues and can provide a personal narrative of the way that these public health issues have affected their lives. Often these are clinicians who can speak to their personal experiences and their practice and provide stories to go along with the statistics and inspire writers to maybe think about these issues in a new way.
Okay, so I'll do the one-on-one answer. Like everything you work on in this room is at the intersections of race, gender, sexuality, and class. And so I imagine the lived experience that you are bringing into the room and the spaces and the research labs with you also reflect race, gender, sexuality, and class. That's the 101, right? Like that should be baseline. The other side of it is I believe, I work with grassroots advocates and organizers. Everything I do is about how it touches ground, which means that I'm actually I'm co-designing, and I think I have all this wonderful expertise. And then I'll tell you about Miss Karen, who's 72, who lives in Philadelphia, who's always like, Laura, she doesn't know how to use her mute button on Zoom, it's a whole story. But she'll just, Laura, no one knows what you're talking about. And I'm like, oh, geez. I advise you to all have a Miss Karen, right? Mm-hmm. You need a Miss Karen. And the other side of it is it's like you should be practicing non-extractive storytelling. You should be practicing co-design. You want to reach a broad swath of Americans and what they believe. Did you think you were going to do that by yourself? right? No, of course not, right? Lived experience is critical to that. I will also tell you, as a person, I have multiple sclerosis. My sister is a neurologist who specializes in multiple sclerosis. And when I was diagnosed, she told me all the things I was going to expect. And you know what? I was grumpy. I was like, didn't nobody ask you? I know you're an expert, right? Right? Sometimes about working with folks with lived experience is knowing how to open a door, but not be the first one to go through it.
Yeah. Thank you.
Great. So Lori, this is for you, the next question. What lessons have you learned from your past work with hip hop, public health, and integrating art and public health?
So when I first joined Hip Hop Public Health, the vision of the organization was to really turn the tide on childhood obesity. So it was really focused on physical activity and nutrition. That's what it was about. And then COVID hit. And we saw immediately that the communities that we sought to serve were being disproportionately affected right away. And we said, well, can we take this model that's been created to build health literacy around nutrition and healthful eating and encourage young people to be more physically active? Can we do it around COVID behaviors? So that's what we did. And we started with hand washing. We started with the simple thing. I think all of my friends here that are in that space are like, yes, hand washing, we need that. And so we created a track, literally in lockdown, the fastest track ever, 3 weeks, everyone working from home studios. We got all of these folks to send in videos, artists from all over the country, to show that they were modeling this behavior. We had Dougie Fresh create a track. It was like, wash your hands, everybody, and everybody, wash your hands. 20 seconds or more, that was the name of the track. And it just took off. We received some funding right away for this. We're all working from our homes. And then people said right away, well, you're going to do it in Spanish, right? We're like, sí, yes, we're going to do it. We never did any work in Spanish before, but we felt it was so important to meet that moment, right? So then we created 20 segundos y más. But then we could not just use that same track, right? We needed to be culturally tailored, culturally relevant. We needed to have artists that resonated with folks that spoke Spanish, right? So there was a different producer, different artist. Dougie Fresh still had a little shout out in there because, he's our founding artist and everybody loves Dougie. But we worked with all these different artists and it just became this like groundswell of excitement, and schools around the country were adopting this as what you did as soon as you walked in the classroom. A school in New Jersey that was specifically for young people that had hearing issues. The whole school created their own version using American Sign Language as well, and there's a remix of that, and then we shared that on our website as well. So we just went down this path, and then we started getting into vaccine literacy. And, that was not our expertise, but we worked with those in the field that were, and we created a resource called Community Immunity, because that was sort of the original goal, and then yes, Imunidad Comunidad. But I think the last thing I want to wrap up with is when we got to the point where we saw that young people who wanted to get vaccinated maybe couldn't get vaccinated, because they were not the decision makers in their household, right? They were 16, 17. They were not old enough to make that decision. They didn't have the agency. So what we did was we brought young people in. We were working very closely with Johns Hopkins Bloomberg School of Public Health with their Center for Adolescent Health, and young people were part of the focus group. We asked young people and their guardians, their caregivers, what was important to you. And we created a whole track called Teen Takeover. And it wasn't about young people being disrespectful to their caregivers. It was about young people helping to educate them in terms of why they wanted to get the vaccine. And so it was called Teen Takeover. It was really successful. We Baltimoreized it because young people wanted to see in the video. We did an animated video, not live action this time. They wanted to see certain HBCUs in the video. They wanted to see certain parks. They wanted to see the waterfront. But then when we made other versions of it, we made it more global, or we made it more to other populations, and we're tailoring it that way. So I guess the use of working with young people, not just telling them, but asking them, what do you want? What do you need? including their voices at the table, but then using different outlets and using those that are in the music industry who are not the doctors, but people might want to listen to them. And they don't need to be the doctors, they don't need to be the researchers or the medical experts, but then to be able to use those channels to have this reverberate, all throughout the country and around the world.
There's a question, yeah, over here.
No, it's okay. Go ahead.
We know the mic?
No, it's coming.
Hi, my name is Fabiana. I'm a health journalist in Brazil, but I'm spending a year here in Cambridge as a night fellow at the Night Science Journalism program here at MIT. And typically I've been working as a health journalist for more than 10 years, and I typically reported on public health and equity issues and this kind of things in healthcare. But I have the impression that after the pandemic, the readers, like in my newspaper, and I think it happens here also in US, are just tired of reading serious stuff about health. They are more interested in health stories about wellness, like diet, nutrition, this kind of things. I know that this is also important, but talk about public policy in health and equity is also important. So I want to ask you if you have any tips on how to, for us journalists and science communicators, how to do all these stories about public policy and public health in a more compelling way for these readers.
I can try to answer that. So one of the things that we found in our research, and I'm going to speak about entertainment specifically, but I think it's relevant to all kinds of storytelling, including journalism, is we tend to tell stories that are focused on individual responsibility, personal responsibility. And that's true across health topics as well as other topics. And I think the pandemic provided an opportunity, possibly an unprecedented opportunity, to really draw the connections between systems and structures and health outcomes, to really make social determinants of health more concrete to people. And we started out great. And, at some point, people got tired of hearing about COVID. And I think the health communication system dropped the ball at some point in failing to kind of carry that thread and show not even necessarily explicitly COVID, but continue to draw the connections in how the disparate impacts of health issues. So in our research, we often see, particularly in medical shows, and medical shows continue to be extremely popular, and audiences trust medical shows. They often trust TV doctors as much as they trust their own doctor, rightly or wrongly. People learn how to do CPR from medical shows, often well enough to keep someone alive until the EMTs get there. So one thing we often see is what we call the hero doctor narrative, where the show actually goes so far as to identify a structural barrier, particularly around access to care, like a patient can't get a needed treatment or surgery due to insurance barriers, for example. And we'll see this hero doctor put their career on the line, possibly risk going to jail. In some cases, we've actually seen them go to jail to provide a patient the care that they need. And what that's really doing is reinforcing these personal solutions. So even when we're seeing the story identify the structural problems that lead to these health inequities, if the solutions that are being presented are individual in nature, then it prevents the audience from envisioning structural changes that can actually promote better health.
Thank you, Melissa.
Maybe just a quick comment also. I mean, back to journalism, there is, and you probably heard of it if you're here in the US, but it's spreading all over the world an initiative that's been going on for several years called solutions journalism. And in Europe, there is a similar initiative called constructive journalism. And I think that what's really interesting about those approaches that are being taught to newsrooms all over the world is that not only does this make your journalism more of a public service, it's the 5 W's plus an additional dimension. Did anybody solve that problem? You're there, of course, to hold power accountable and to uncover, to investigate, and the result is readers say, that's awful, terrible, and isn't the world off, isn't everything terrible? What they're finding is that there's evidence that they present that people stay with the story longer if you show that somebody solved the problem somewhere or somebody has a solution. Mm-hmm. And that feeling of what the Reuters Institute every year does a study on the state of the media, and year after year after year, they're finding that there's more and more news avoidance, and it's not because people don't want to be informed, they just feel overwhelmed. Mm-hmm. And that one antidote to that is to offer this kind of solutions journalism reporting. I'm a huge supporter and fan because they also just find that it turns journalism back into that pillar of democracy that is providing a public service as well as doing the investigative reporting that we all need.
Can I just add a quick thing to that? So speaking of solutions journalism, last year I was interviewed by an organization called Solutions Insight Lab, which did an entire project interviewing a couple of hundred nonprofits that were working in the social sector. And while it was wonderful for us to be out there and talk about the work and get some exposure, and I believe it was funded by the Skoll Foundation, what was really great was when they did the analysis after meeting with all of these nonprofits working in all these different areas, that there were these commonalities and through lines, and not to sort of reinvent the wheel. And for me, running an organization, it was a great learning experience for me. And then this whole database of other solutions that had been generated through other sort of peer organizations or similar organizations, it was very, very helpful for me, and it was great sort of for the nonprofit field. So I would just echo that from a little bit of a different perspective. And then the last thing, if I could just add, is, I understand, maybe the trend is going to be high-end wellness and things like that, but if the world of journalism could also share the things that don't cost anything, like the things that could be simple and done, maybe even in a room just like this, that a couple of minutes of physical activity could like lift mood or shift affect, and to be able to highlight those stories that are public health or education, health education resources that actually can make a difference without any cost, any equipment, anywhere, anytime. And so being able to highlight those stories as well would be wonderful to see more of.
Wow. Well, I really enjoyed hearing the solution-focused approaches, very powerful. And so, Melissa, you have the next question. How does your work at the UN Department of Global Communications combat health-related disinformation globally? And what strategies have you found effective in countering misinformation through storytelling?
Thank you. I just wanted to start by saying we are becoming overwhelmed too, because we're in a moment. We thought that we were in a really difficult time now, but the information war, the attacks on science, but now we're being attacked ourselves. Those who are delivering facts, those who are advocating for science, climate activists, for example. Are in Brazil. It's a huge, huge problem. They communicate facts online. They advocate for change. They're attacked online, and then they're attacked offline. And The license to do this, I'm afraid, given the current political climate we're in, is only going to get worse. Our communication strategy in this atmosphere is to continue to speak the facts that are based on science. We continue to sound the alarm. For example, we're seeing the largest, according to WHO and UNICEF, sustained backslide in childhood immunization in 30 years. And this is partly or mostly due to COVID-19 anti-vaccine narratives, but also the ones that continue. People stopped communicating the facts when COVID ended, and others continue, the disinformation actors continued to communicate the conspiracies. And the conspiracies that were, for the most part, most of them originated here in the US, because thanks to social media, they've traveled around the world. And when UNICEF shows up in a village in Africa to a family where before they would have been welcomed with open arms, they're no longer being welcomed, and we're seeing everywhere a rise in polio, measles, diphtheria, and this is not just here. So what are we going to do? We're going to also say vaccines have saved 154 million lives over the past 50 years. We're going to tell the story of, and it's the 80th birthday of the United Nations this year, and so we're going to tell the story of scientific advancement, of the peace and security and the stability that we've been able to bring about, but also the honest story that we can't do it alone. This was not really about the effectiveness, and I think I to your question, talked about that before. We do absolutely audience segmentation. We try to speak to the persuadable middle. We try to understand who is going to move the needle and how do they receive information and what will move them. But I just want to also raise the alarm that we're in an unprecedented time right now where we all are going to have to step up and communicate facts and just be as strong as we possibly can, because there will be many more voices that are going to try to undermine what we're doing.
Thank you. Well, we have time for one more question. Laura, your work at PolicyLink and Birth Equity Leaders emphasizes co-creation. Mm-hmm. How do you ensure that communities feel ownership of the stories that aim to transform them? And how do we ensure that the right voices, not just the institutions, are at the forefront?
Yeah, I think I hit on some of this. I think the other thing I'll say is that nothing I've ever done has been like, Laura Hughes is brilliant, she's at the forefront of this. I mean, I could, but go with it. But seriously, all the work I've done, like my housing justice work, we convened 52 housing leaders from across the United States who came together to produce and co-author, right? When I worked with a set of Black midwives and doulas, we gathered 30 Black midwives and doulas in Puerto Rico to design the toolkit that we then use to tell stories. Mm-hmm. So none of this, and the best work is not, I love comms folks, I'm one of them, but that's not what this is about. This is about the people we serve, right? And I also truly believe, everybody brace yourself, those that are closest to the challenges are closest to the solutions, right? And so I'm not taking any away from anyone who is a researcher and has provided expertise that has helped save so many lives. I also am saying that if you want to communicate that with folks who will care about it, you need to do it in co-design models. So I think that would be mine.
Thank you. So on behalf of Jylana and myself and the planning committee, thank you for such a rich discussion.
So there is another treat for you all. Lori has an activity for you all that involves music and getting out of your seats. So I'll defer to Lori to share more.
All right. So I know, yes, no?
I was confused about that versus the video.
It's a little bit all together. You're welcome to stay up here or not stay up here. You'll be on display though. You're gonna have to dance with me.
We don't.
So, well, first I think we should give a round of applause for the whole panel. and the incredible moderators.